Okay, behavioral and mental health. And I will finish this up quickly. So suicide rate has decreased, and this is CDC data. I've hyperlinked everything for you, by 5.6% as of 2020 compared to 2019. That's misleading. The data is going to continue to be cleaned, so it's probably going to go up. And it doesn't provide any demographic breakdown, so we don't know how bad it is for the communities at greatest risk. Overdose deaths, on the other hand, those have jumped over, well, nearly 40% compared to 2019. And following on with what Sal was saying, a study in JAMA that was, I think, by the Canadian Health System showed that over 70% of their overdose deaths have been in men during the pandemic. And this, again, has been supported by a JAMA article that was from UCSD or UCSF, excuse me, where they demonstrated, racial, ethnic minority communities, Latinx, and Black communities accounted for a disproportionate number of these suicide deaths. And we think of essential workers, transportation issues, increasing stress, not having access, or associated with excessive stigma that's keeping people from getting the resources they need. So the last piece there for what OASH is doing, we're working on a now secretary level behavioral health coordinating council that's going to be addressing these issues for vulnerable populations. And I think it's very important to realize that as we go forward, and let me highlight something that Sal said earlier, for tribal populations, adolescent youth, American Indian, American Native populations, they had a 4-fold suicide risk difference as opposed to Black youth. And that's even greater than non-Hispanic youth and white. So in terms of allocating resources and knowing where the greatest good can be done, I think you said missing links. We need to find those missing links and make sure that these populations aren't forgotten.